talking with Dr. Karen Grothe, a Mayo psychologist. Dr. Grothe, what is the connection between obesity and depression?
Well, we've known for many years that there has been a link there, and it really seems to be a reciprocal link. When longitudinal studies have tried to tease out which came first, it seems that people who have obesity without depression to start with are at risk for depression down the road, and vice versa. So it's a strong link that's there, and people who have obesity are at risk and should be monitored for depression, and people who have depression should have their weight monitored.
And what is emotional eating, and how does it differ between men and women?
So emotional eating, we tend to think about generally as eating in response to any kind of emotion. Most often we hear about negative emotions like stress or depression, but we might eat differently in response to positive emotions or to celebrate as well. And we know that for people who are emotional eaters, men tend toward more meal type foods, so the meat and potatoes type of thing, where women tend more towards sweet and carbohydrates when they emotionally eat.
What is food addiction, and how does it differ from alcohol or drug addiction?
So food addiction is a pervasive concern about food, awareness of food, seeking out food, eating food despite negative consequences. So maybe my blood sugar levels are high, but I keep eating the sweets anyway. So it is a construct that is still controversial in the literature as to its existence, but also is it a separate construct from binge eating disorder? And it differs in that the drugs of abuse, people can approach with an all or nothing type of treatment. I can be completely abstinent from tobacco, alcohol, drugs of abuse, not ever need those again in my life. Whereas food, we have to find a moderate relationship with. We cannot do the all or nothing, and that's harder for many people.
And how can people manage their food triggers?
So a lot of people eat in response to various triggers. That might be emotions, it might be people, places, times of day, certain foods or smells of certain foods. So people really need to identify what their main triggers for eating are, if it's that 3 p.m. time of day, or if it's stress, or a certain place in the office. And then they need to really figure out how to try to avoid, limit, or master those triggers.
Thank you very much.
Thank you.